Our next topic is definitely on the minds of many as flu season approaches: getting vaccinated. According to the CDC, more than 200,000 people in the U.S. are hospitalized from flu-related complications, and about 36,000 people actually die from flu-related causes every single year. And add to that the current concerns about the H1N1 virus or swine flu, and now you understand why health officials are stressing more than ever the importance of getting vaccinated. Well, this morning we've invited a few experts to help us better understand flu and vaccines, and we're also going to hear one woman's very personal story. But first, please help me welcome Dr. Gaby Cora from the Executive Health and Wealth Institute and Susan Gordon, a pharmacist at CVS. Good morning.
Good morning.
Thank you for being here.
Thanks.
The first thing I wanted to ask you, doctor, was the difference between the swine flu, the H1N1, that we're hearing so much of, and your seasonal flu.
These are different viruses that affect different people. For example, the seasonal flu tends to affect the elderly and the young kids as well, and anyone who has a chronic condition or is more vulnerable, whereas the swine flu tends to affect younger people up to the age of 25. So there's a little bit of a difference there. In terms of what is common to both flu viruses is the symptoms. So people would be coughing, they may be having a runny nose, they may have headaches, they may feel aches and pains with fever, and sometimes they can also have nausea, vomiting, and diarrhea.
Which leads me, Susan, to what's happening where health officials are urging people to get vaccinated. Are you seeing that also?
Definitely. As you mentioned, the statistics are overwhelming, the number of deaths and the number of hospitalizations that occur from flu. So it's important that people are getting in and getting their shot. And it's also important that they understand there is a difference between the seasonal flu and the H1N1, two different vaccines.
Now, I have to say I'm guilty of never being vaccinated. I kind of figure I'm a healthy woman, and I honestly, I just say I don't have time. Shame on me. And I'm sure there's many people out there, too.
Well, the thing is, we really don't know if you're immune to some of the viruses that may be out there during this season, and that's what the vaccine would help you prevent to do. And it is true, many people say they're busy, but in a way, preventing people from getting sick is very important, just like, you know, it would prevent someone from going to work, kids from going back to school, and it would affect the household when you have several people who can be sick at different times.
Sure. And pharmacies are actually stepping up to the plate now, Susan, aren't they, to help people, even like me, that say don't have time to go to the doctor, get the flu shot?
Yes. CVS pharmacies, for example, are offering over 9,000 flu clinics nationwide this year for somebody like yourself who maybe just doesn't have the time. You can find where there's a clinic closest to you, stop in and get that shot.
And sometimes I even think, you know, oh, my kids are too young, they don't need it. I'm wrong.
Well, it's very important to consult with your pediatrician because they may not offer it directly to you, as this is not a compulsory. It's not obligatory to get your kids vaccinated, but if you want to protect them, and particularly if for people who may have kids with chronic conditions,
correct,
you really need to be able to protect them.
And it's important with timing. You really have to get it early, don't you?
Timing is very important. The flu season is coming up now during the fall and winter season, so the earlier that you can get vaccinated, the earlier that you're going to be able to develop that immunity.
All right, I have more questions, so please stand by. And also, when we come back, we're going to hear firsthand a very compelling reason why we should take this subject very seriously. So don't go away. We'll be right back. Welcome back, everyone. Well, this morning we've been talking about the flu, the seasonal flu, and the H1N1, and the importance of getting vaccinated this flu season. Well, joining our experts is a board member of the group Families Fighting Flu. And more important, she's here to share her very, very personal story about this subject. And I'm very pleased to welcome Jennifer Lastinger. Thank you for being here this morning.
Thank you for having me.
I know you have a very difficult story to tell us. You lost your 3-year-old daughter, Emily, because of the flu. And in such a short period of time. Can you tell us what happened?
You know, it's a mother's worst nightmare.
Yes, it
My
is.
daughter was diagnosed with influenza. She became progressively sicker with normal influenza, and in the course of several days, she was gone.
She just died, and there was nothing that could be done.
She was gone, and what could have been done is I could have had her vaccinated, and I didn't.
Something as simple as that.
I really believe that something as simple as that, a choice that I didn't really make a choice not to have her vaccinated,
Right.
but I did not have her vaccinated.
Now,
Simple.
I know you tell me that Emily lives in your heart every day because you speak on behalf of Families Fighting Flu. And that's your way of keeping her memory alive. And what are you trying to accomplish there, Jennifer?
You know, we are just a group of families. We're parents whose children have been taken from us from influenza. We just really want to educate other parents, other people about the importance of annual influenza vaccination and just how serious influenza can be. I mean, it changed my life.
May I see a picture of Emily? Do you have one?
I would love to show you.
Oh, she's beautiful.
Thank you.
And this is her brothers. Doctor, as I see this picture, and as a mother, it breaks my heart. The message is clear here. I mean, everybody needs to get vaccinated, and I think the rule of thumb now is 6 months.
6 months, and you know, it's very important to try to protect the kids, not only from influenza, but from some of the complications. So vaccination is very important for moms and dads to go to their pediatricians and discuss this.
And shame on me, because Jennifer, and she knows this, I've told her how I haven't vaccinated my kids. The excuses of there's no time. Pharmacies are now making it a lot easier, right, Susan?
Yes, there's so many different opportunities now to get that flu shot. There's really no excuse, convenience, time. There's really no excuse not to have that shot.
All right, thank you so much for your time this morning. Jennifer, thank you for sharing your story with us. And you've actually, you've changed my way of thinking of this, and I'll definitely make it a point.
Hopefully I'll change a lot of parents.
I think you're doing that one step at a time. Thank you so much.
You.
And for more information, check out flusource.com and familiesfightingflu.org. Of course, we'll have these links on the Balancing Act website to make it easy for you.